Hello everyone, my name is Dr. Sandy and today we're going to be talking about arthritis and specifically osteoarthritis. If you're watching for the first time, my name is Dr. Sandy, practicing doctor of chiropractic. It's been 24 years that I've completed, going to my 25th year. I love going to work. I love what I do. I love seeing people naturally get better through precision-based chiropractic. Me and my team have been blessed. We've won multiple awards, including Top Chiropractic Office in Mississauga, Top Chiropractic Office in Peel Region, because we love our patients, we care for our patients, and we are getting results on the regular. And we still want to get better, but it's something I absolutely love. I love going to work. I love seeing people just getting to their true self. When they feel healthy and strong, I'm telling you, the world looks different. Everything is just amazing, obviously, when you're feeling better. And I got to share a story with you. We had a lady, it's taken work. It's been over several months at least, but she came to us, a lot of pain. She was saying she was crying every night and just looking for help. And she came to us, she was in a wheelchair and she couldn't move properly. And, it took a lot of work and stuff, but now she's coming in, not using the wheelchair. She's free. She's starting to use a cane now, but she feels good. She started dancing a little. So just seeing those kind of stories, those things happen over time. It's just, I can't tell you how gratifying that is. And I feel honored to be a chiropractor, and I want to help as many people as possible and get that message out that chiropractic is here to help. It is a natural way to work with the body, to work with the spine, which is one of the most powerful parts of the human body. And it's something we need to care for. We need to do everything we can to not only care for it once in a while, but on the regular, so we can have a good quality of life. So let's get into first, what is osteoarthritis? So osteoarthritis is basically that classic arthritis that we think of with people getting older, where movement starts to get limited, a lot of stiffness in the body, and it just really slows you down. And it's really associated with getting older. When we think of someone older, we think like their posture is getting affected, they're not moving freely. It could even be things like getting up in the morning and you're stiff, or you're driving in a car and it's hard to kind of move properly, or you start to hear almost like a grinding sound in your neck or low back, and your joints are starting to hurt, knees are starting to hurt, or ankles, and it's not pleasant at all. And for a lot of people, they might try to apply heat and they may do stretching. They might try to change their diet. Obviously, drinking water is a good thing. Avoiding foods that are highly processed, which are inflammatory. Stress is a big thing. Chronically being under stress inflames the body. Being under stress causes the muscles to tighten, which will kind of push on the vertebra, make that even causing like further damage. So we want to do things to help. So if you're listening to this, maybe try applying the heat, drinking the water, doing those things. Stretching obviously is always going to be a good thing. Trying to manage your stress. If those things aren't working and you're watching, maybe you've gotten to the point that maybe you need some medication, maybe you've tried some creams. Obviously, as a last resort, sometimes the doctor may say in extreme cases, injections or possibly surgery. Those are things we want to avoid. And here's the thing I want to share with you is that what I love about the paradigm of chiropractic is that it's a very proactive model. So I think when I look at kind of the classical healthcare system, yes, we need those drugs. Yes, we need surgery at times for emergency care. But as we're getting educated as a society, I think we're starting, what I hope is at least happening, is we're starting to look at the body and saying, number one, people have to take ownership. We have to say, it starts with me. I need to get healthy. I need to get strong. I need to make that lifestyle change. And then what I believe in healthcare is, let's start with the natural stuff that are going to help the body, as conservative as possible. And then, yes, we can always look further down the road at like the drugs and surgery injections. And I get that, but I think there's a lot we can do in those early stages. And what we need to do first is say, hey, am I proactively taking care of my body? And the minute you get those little symptoms, you have to take action. I think a lot of times what I've seen is people will come in, and I don't even understand this, but people will come in sometimes and they're like, yeah, I've had this issue for 6 months. It's been a year. It's been a couple of years. And I'm like, wow, like I'm the kind of guy, if something doesn't feel right, I try to get on top of it. I try to, research it, learn about it, see my chiropractor obviously on a regular basis. But I'm always the kind of person, like what we should do is the minute a small problem starting, that's when you take action. Not this like, let's sit back and wait. Let's wait till it gets really bad and then I'll do something. Because the risk with that is that the longer you wait, the chance that something natural is going to help you goes way down. If you wait till you can't move it and it's extreme pain, you'll probably go right to drugs and surgery. And again, yes, there's a time and place for that, but I believe most people, if they can, would like to go natural first. And then here's another thing I would share with you. Once we help our patients, we always give them that option. We always encourage and say, wow, you've come in, you're feeling so much better. Let's maintain it now. Now, we don't need to see the visit frequency as much now, but we've done the hard work. You're feeling stronger, you're feeling better. Let's maintain it. I think that's the other thing is that number one, when we find those symptoms, let's act on it. And then number two, once you're feeling good, let's maintain it. I don't agree with the philosophy that says, okay, I feel good, let's wait till it gets bad and then I'll start to take care of my body again. I think once you feel good and strong, you should maintain it on some level, whatever you feel comfortable with. Like, look at what dentists have taught us. They've been great about this. We need them, we go to them, we get those professional cleanings, but we don't wait till our teeth hurt and start to brush. We've been taught from the beginning, you got to brush your teeth consistently and still work with a professional to make sure you have the best outcomes. It's not a very reactive process. It's a very proactive process. Brush, floss, see the dentist. I love that. And I would have the same vision for chiropractic, that we teach people that you got to stretch, you got to eat good and manage your stress, but you need to see the chiropractor, have that system in alignment. And the number one thing with chiropractors is we are working on the nerve system. So we want good, healthy neurology. We want the brain talking to the body. We want good muscle contraction. We want the organs working well. But on top of that, a big benefit with chiropractic is keeping that spine, keeping that body in alignment, keeping everything balanced. What's going to happen if there's a person who is in balance, there's no joint stress, and they're getting adjusted regularly through chiropractic? That will slow down or possibly even prevent certain types of arthritis. So keeping that alignment, keeping things balanced, making sure everything's sitting to where it should. And I always think of a car. So if you have a luxury car, maybe you drive a Mercedes or a Lexus or whatever car you have right now, and you're driving, and let's say you have the best car in the world, but that tire is misaligned. Number one, it's going to affect performance, and over time, that tire, which may be at the front passenger side, because it's misaligned and you're driving, will wear out faster because it's not in alignment. The exact same concept is in chiropractic. Someone may have a hip, let's say for this conversation on the left side, that's not in alignment. It's not sitting where it should, or whatever the situation is. That joint will wear out faster because it's not in alignment. So the big benefit with chiropractic, there's so many benefits. So again, obviously working with the nerve system, but having things in alignment prevents degeneration. And no one wants degeneration in the joints. You definitely don't want degeneration in the spine. Degeneration in the neck, I mean, that's going to affect everything from functioning in the brain. We're talking like blood pressure impact, swallowing impact, breathing impact. This is such a critical system, right? If we have anything at the base of the spine, that can affect your ability to move properly. And depending on what vertebrae involved, that could potentially affect bowel movements, the bladder function, hormonal function, so many things. The spine is so critical. It needs to be taken care of. So what I would say to you is that I hope you're taking care of yourself naturally, doing the right things, but I would really encourage you to get a spinal checkup. It's something we offer in our office, and you can call us at 905-896-3393 or text us at 905-896-3393. Reach out to us. Maybe you have a general question or something, but we're here for you. You can also visit my website at www.gopowerflow.com, GOPOWFER. I gotta respell that. GOPOWERFLOW.com, gopowerflow.com. I'm sorry about that, guys. But call us, reach out to us, 905-896-3393. Visit our website. We're here for you, but it's worth getting checked. It's such a critical system. I can't even tell you, having a healthy spine changes so many things, that good quality of life. Let's be proactive. Let's look for natural solutions. We need to take care of the human body. So God bless. I hope you learned something from this video. I hope your life gets better. Best to you and your family, and God bless you.